How to use a dry powder inhaler, DPI, for asthma. If you or someone you know has asthma, understanding how to use a dry powder inhaler can make a big difference. This device delivers medication directly to the lungs, helping to manage asthma symptoms effectively. Let's break down the steps for using a dry powder inhaler correctly. First, prepare the inhaler. Hold it flat and avoid shaking it. Depending on the type of inhaler, you may need to slide a lever, twist a base, or open a cover until you hear a click. This sound indicates that the dose is ready for use. Next, breathe out fully. Before placing the inhaler in your mouth, exhale completely away from the device. It is important not to breathe into the inhaler, as moisture can affect the powder. Now, position the inhaler. Place the mouthpiece between your teeth and close your lips tightly around it to create a good seal. This step is essential for effective medication delivery. When you are ready, inhale the medication. Take a quick and deep breath through your mouth. This fast inhalation activates the inhaler and pulls the dry powder deep into your lungs, where it can work best. After inhaling, hold your breath for about 10 seconds. This allows the medication to settle in your airways, maximizing its effectiveness. Once you have held your breath, exhale slowly away from the inhaler. This helps to ensure that the medication stays in your lungs. After using the inhaler, close it to keep it dry and ready for the next use. If needed, wipe the mouthpiece with a dry cloth. It is important never to take the inhaler apart or get it wet. Additionally, rinse your mouth with water and spit it out after using the dry powder inhaler. This practice can help reduce the risk of irritation or fungal infections in your mouth. Remember, dry powder inhalers do not require shaking, priming, or spacers. The medication is in powder form, so a fast and deep inhalation is essential for it to reach your lungs effectively. Some inhalers come with dose counters to track how many doses are left. If the counter shows 0, do not use the inhaler. If you accidentally breathe into the inhaler after loading a dose, you may need to reload a new dose. Always follow your healthcare provider's instructions regarding how many puffs to take and when to take them. If you find it difficult to use a dry powder inhaler during an asthma flare, due to the required inhalation effort, consult your doctor for alternative options. Using a dry powder inhaler correctly is key to managing asthma symptoms effectively. Proper technique helps keep your airways open and reduces inflammation. If you have any questions or need help with your inhaler, do not hesitate to ask your healthcare provider for guidance.